Establishing rapport, establishing trust with a patient has been paramount in our organization since founding. And understanding that there were limitations to building rapport and building trust when we weren't there in the room, we had to determine how can we do that virtually, and that was eventually formalized in breaking through the screen. What it does is really train a physician or a nurse practitioner to be an excellent virtual care provider. How do we build relationship? How do we build rapport? How do we build confidence that this is going to be just an awesome experience for the patient?
When we talk about a provider breaking through the screen, we're talking about that provider developing a therapeutic rapport with a patient in real time, which is incredibly important. The only way a patient's going to open up to us is by seeing our providers as human beings that care about them and not faces on a screen.
Patients in neurology and acute neurology are generally in a very stressful situation. They're somewhere that they're not familiar with. They're not oriented to what's going on in a hospital setting or the ED, so it can be very stressful for them. And so our neurologists are selected for their ability to comfort those patients on the other side of the screen as part of that ability to break through the screen.
For what we do in high-risk pregnancy care, absolutely breaking through the screen is first and foremost on our mind. It is one of the kind of central guiding principles of what we do. We know that we have a patient who is potentially very scared in an ambiguous situation that's compromising either her health or her baby's health. How we work through that is by trying to develop trust as quickly as possible, really meeting patients where they're at, asking a lot of questions. And those don't necessarily have to be questions that are digging deeply into the medical side of their disease process, but really understanding each patient where they are. What are the other factors that we don't know about? Do they have other children at home that they need covered? Is their husband traveling for work and immediately not available? All of these other things that help us better understand the patient that's on screen in front of us, help us actually transport ourselves into that patient's room and be at the bedside with them and be the type of doctor that you would expect take care of your family.
The breaking through the screen philosophy really guides them to give the patient confidence that we are going to give them the right care, timely care that's going to make them better. We know that patients do better when they have that.
The way to foster the best treatment in a hospital setting is if the nurses and other professionals in the hospital see us as providers upon whom they can rely and not just a screen. We are delivered to the hospital via a screen, but we interact outside and beyond that screen. That's the standard to which we hold ourselves.